Thank you, Chair. Thank you for being with us. I'd like to hear you say a few words about the federal government's commitment to modernize services, equipment, technology, access cards, and data collection in FBT agreements. We often hear stories about equipment, MRI machines. We met with people who talk about how fax is still being used for appointments. So there's a lot of modernization that needs to be done in the system. It could lead to some important savings as well. Even access cards, accessibility to patients' files. All of this can be modernized. I'd like to hear you say a few words about this. Very well, thank you for that question. First, I would note that in the agreements that we will be signing with provinces and territories, there are provisions on data and information sharing. At the deputy minister level, we recently developed an interoperability plan. So what will this mean? Well, systems in provinces and territories, for example, in a doctor's office, are often digital. So, your doctor might have your file on a computer, but their computer is not talking with other computers in other doctor's offices and hospitals. What we want is a plan to have all the systems speaking with one another. This would mean there would be technical standards for information sharing and data standards. So, for example, all data would use the same terminology. This plan was developed by Inforoute and Health Canada in partnership with provinces and territories. Currently, all provinces and territories except Quebec have indicated that they would be adopting these standards to ensure comparability across the country and systems that are better able to speak to one another. We are using international standards. We're not making up our own. And this would also then help Canadian businesses get international clients. Provinces committed to this as part of the February funding announcement. How long will that take, though? There's already an agreement on a plan with provinces and territories. Over the next few years, we will be putting the plan in place in partnership with provinces and territories. Now, some provinces and territories have already started. Quebec has a bill on this topic. Which would ensure better information sharing between health systems and which would provide Quebecers with better access to their own patient files. That's another issue that we're interested in. We want patients to be able to access their own electronic files. Furthermore, this is an indicator put in place within the FPT agreements. So there are agreements, but it's a whole question of time. Let's say a patient owns their file. Like that would be the case in a bank. If you own your file, you can share it with whoever you want. So at the end of the day, a patient would be able to own their file, share it to whoever they want, and all of their medical information would come with them as they move around. Is that where we're going? Yes, that's the vision. Now, it will take time. It's not simple. But yes, that's what we want at the end of the day. That's why it is one of the 8 indicators that the minister talked about. Patients should be able to access their own electronic files, and electronic files should be able to be shared in different health institutions. Thank you. Do you want to add anything? If I can just follow up on that. You also talked about health cards. And a few years ago, there was a collaboration between Health Canada and PEI and their health authority. They decided that on their PEI health cards, it would list the patient's preferred official language. This would let them get a better sense of demand for French services in the province and plan accordingly. Patients could also be directed towards the appropriate services, which would make things run smoother. Things run more smoothly if you know from the very beginning that someone wants to be served in French. They could be channeled, or rather referred to the right person. It's not exactly high tech, but it's worth noting. It let PEI understand demand for French, but also understand diversity, because it wasn't just official languages that were included, other languages as well. Officials were surprised to discover that their little island of 100,000 people was home to a range of languages and dialect. So this initiative also led to a better understanding of diversity in PEI and made people more aware of linguistic and cultural diversity. Other provinces are looking into something similar, like Saskatchewan and Manitoba. Ontario is also considering it in some degree. And as part of Health Canada's official languages health plan, which is set to be funded under the next action plan, we could support such initiatives.